This is Adrian Hart with your Southeast Colorado News on seconews.org. We're here at Otero College with the Colorado Behavioral Health Administration. Our coverage is sponsored by our healthcare category sponsor on seconews.org, Ryan Medical and Associates.
Resources around the room. I hope you got the chance to look around at what you all have here locally in this region. Lots of resources and help. So thank you all so much for joining us. I know that this is kind of dinner time, it's rush time, so we really appreciate you spending your early evening with us. Dr. Russo is so today is the first time we're coming to La Junta. Last year we did community conversations with Commissioner all around the state, and La Junta was #1 for this year, so we are really excited to be here. Thank you all for joining us and all the great work that you do in the community. My name is Judith Tieku. I am the Colorado Lift Community Engagement Administrator, and what that means is just really supporting BHA and our BASOs with community engagement strategies, and also just making sure that community members voices are heard in the work that we do and the policies and the services that are provided within the community. Thank you all so much for joining us today. Before we start all our meetings, we would like to do a long acknowledgement, and I'll take some time to read that whole statement. We recognize that these facilities are situated on the traditional territories and ancestral homeland of the Ute, Arapaho, Cheyenne, Dene, Lakota, Apache, Puebloan, and other native nations. These tribes are the original stewards of these natural areas and have faced devastating impacts due to forced removal and assimilation, which are part of our shared history and continue to influence their health and well-being today. As part of BHA's commitment to enhancing behavioral health services, we are dedicated to understanding and integrating the knowledge, traditions, and practices of Indigenous peoples to better serve all communities in Colorado. Our acknowledgement is an initial step towards addressing the historical and ongoing impact of colonization, and it reflects our commitment to making our services more inclusive and responsive to the needs of Indigenous communities. And this is really just a first step to all the actions that we are really embarking on to ensure that behavioral health services are provided on reservations to Native American community members. And so throughout these community conversations, we actually went to visit both the Ute among Ute and the Ute Southern tribe, the Southern Ute tribes in Memphis in June. And so we went to really discuss behavioral health services in the community and to really strategize and collaborate on culturally relevant services that really work for people. So we really are committed, and it's one of the reasons why we're here today. We know that not all services and all strategies work across Colorado, and so it's really important for us to hear your voice and to learn more about what works for you in Southeast. So thank you again for having us. As you can tell, Commissioner wasn't able to be here. She sent her regret. Commissioner is double, triple booked, and so Commissioner is presenting at a conference now. But we are very lucky to have Dr. Aisha Russo. Dr. Russo makes everything happen. And so I'm really excited to introduce you all to Dr. Aisha Russo. Dr. Russo joined BHA about a year ago, and she really is, she is the force in BHA, really driving our strategy and making sure that everything we do is really in line with what works for community. So thank you so much, Dr. Russo.
Thank you. As Judith mentioned, Commissioner and I are tag teaming. Don't know if y'all have heard, there's a little bit of a federal shutdown going on. And it has preoccupied us. Let's go with that. For the last couple of weeks, I guess 2 weeks now, that has been fresh on our minds. So we are tag teaming across the state today. So it is my pleasure. This is actually my first time in La Junta. Couldn't have asked for a better day. The weather is beautiful. I will blame that on y'all. Thank you very much. And we're happy to be here, and we really are excited about hearing some of the concerns that you all have in this particular region. And I'm particularly excited to talk to you all about some of the work that we're doing with our rural and agricultural communities coming up. So that's it for me. I'm going to turn it over to you.
Thank you. Yeah. So throughout these community conversations, so last year was kind of the first round of community conversations, and one thing we heard over and over and over again is that community members and community organizations, small, medium, large organizations, are making a huge difference in community members, in the lives of community members, and providing behavioral health support and services, and also just the collaborative work that you all do within community has really been resounding. And so this year, one thing that we started was community champion awards, and these are anonymously nominated community champions who receive these awards and nominated to receive these awards for just the great work that they're doing within community. A lot of you are doing great work, but these are some of the folks that really kind of bubble to the top. So today I'm really excited for us to award 2 community champions today here in La Junta. And our first recipient is Bradley Rowe.
Thank you for your work.
Thank you. So Brad is the Veterans Outreach Coordinator for SSG Fox Suicide Prevention Program, and he works with so many different counties. I'm sure you all know. I heard a lot of familiar notes and comments, but Otero, Crowley, Bent, Prowess, Baca, and Kiowa, and so Bradley collaborates with a lot of organizations and a lot of agencies to really support community members. Bradley, do you want to say a few words about the work that you do?
I couldn't do it without the veterans in the community. My Veteran Advisory Council is my right hand, so I thank them. Thank you all.
Thank you. Our next awardee is Christopher Menges.
Woo!
Chris is the Substance Use Disorder Program Director at the Otero County Health Department, and Chris's leadership of that program has really made a lot of strides within community, providing resources and support for our neighbors, family and friends, and the Rural Recovery Network is an amazing program that serves the Arkansas Valley, here, Otero and Fremont, and also the San Luis Valley. Thank you so much, Brad. Do you want to say a few words?
Yeah, sure. I'm a little conflicted by this. The last time I was holding something like this, I was presenting it to someone that didn't feel he was worthy of it. And I told him to shut up and be humble about it and accept it. I'm going to accept it in that spirit, but I want to share it with everyone in the room because I'm just a cog in the machine and it takes all of us. So I'm very humbled, very honored by this. It all starts with great management. I want to thank the madman at the Otero County Health Department that taught me something really important early on. Do nothing illegal, do nothing immoral, do nothing unethical. Other than that, go help people. So that's the spirit of what we do. I want to thank my wife for standing by me when I decided to do a crazy late in life lane change at 50 plus years old. So thank you all.
Thank you. I always get a few tears over these. It's so amazing. Thank you all so much for everything that you do. I'm going to hand it over to Dr. Russo.
All right, fantastic. Thank you. I assume if you're out here today, you are either already familiar with the BHA or interested in becoming acquainted with the BHA. So I'm going to poll the room. How many of you all are well acquainted with BHA and the work that we do? I love it. How many folks are here and learning about BHA? That's great too. I love it. Okay, all right. I always just like to know who we're talking to. Well, BHA is the newly revised version of OBH, Office of Behavioral Health. It was reinvented about 3-4 years ago, and we reassessed and reevaluated our mission and our vision. Our mission is to co-create a people-first behavioral health system. In that, we really like to ensure that we are saying that it's meeting all the needs of folks in Colorado. So someone who's living in an agricultural community, that may look very different than someone who's living in an urban metro community. And when we say that we truly intend for it to be people first, focus on the people who are needing the services, it should not matter whether they are living in an urban environment, an agricultural environment, a rural environment, mountain environment, doesn't matter. We want to ensure that the behavioral health system is accessible to folks. And that goes right in line with our vision, ensuring that the behavioral health system is accessible, meaningful, and trusted. By accessible, we mean physically accessible, like people actually know that it exists. They can actually get to where they need services. That's for folks with disabilities, without disabilities. They can physically get to it if needed. And that it's meaningful and trusted. Who's gonna call to talk about their behavioral health needs if they don't trust the system? That'd be nobody. So we wanna make sure that it is a system that folks are trusting and recognize and acknowledge this is where I can actually get some help. Be it emergency, immediate help, or even if it's, I'm just having a bad day and I need to talk it through. We want to make sure that people can receive whatever level of service they are in need of. As we go into 25 and 26, Commissioner Smith has identified 4 bold goals that are directing all of the work throughout BHA. We have about, I think I got a count yesterday, of 158 employees within BHA. And so these 4 goals, we call them our 4 bold goals, are leading us into where we will go until the end of this current governor's administration and into the new administration. So access to behavioral health services, streamlining behavioral health and criminal justice, statewide behavioral health crisis system, and prevention and upstream support for children and youth. So we are at this very interesting place right now in BHA where the commissioner explained what her vision was, and each of us had to take this and say, how do the areas that I oversee ensure that it is identifying all 4 of these and making sure that the behavioral health system is accessible, trusted, and meaningful for everybody that needs to access the system. So, as an example, as the Chief Strategy Officer, I'm responsible for taking the vision and ensuring that the strategies are executed across the entire agency. I oversee the rural and agricultural folks, the tribal folks, workforce development, and all of our project managers that ensure that they are helping everyone across the entire agency execute these types of goals. So these are our 4 bold goals. As many of you are probably aware, one of our huge goals this past year, July of 2025, was executing the BASOs. That was our huge goal at the beginning of this year. And once we accomplished that goal, there's still work that we are doing on the BASOs. We'll talk a little bit more about that, but then we roll right into our next 4 goals. So as we talk about Colorado's children, youth, and families in the behavioral health care continuum, this is a part that is really near and dear to Commissioner Smith's heart as she talks about ensuring that children are receiving services at the lowest care needed. That way it does not elevate and grow into an issue of high acuity, elongating the length of time that children are receiving care. So you'll see this entire continuum: promotion and prevention, early intervention. That's the area that we really want to get ourselves to, that we're focusing on, the yellow and the orange. But right now, we are really focusing on the green and the turquoise, outpatient level treatment, intensive community and home-based treatment. A little bit of residential and a little bit of inpatient. We recognize throughout the state there's not a whole lot of residential and inpatient treatment that is available. So we've really been brainstorming and working with organizations that serve children, youth, and families to see where we can broaden these areas and make services more available. And then transition and recovery. Of course, we want to get folks through the continuum so that they get to the transition and recovery stage and people can move on, particularly youth and family, or youth and children, and continue on and continue to be healthy and move forward. That was quick. All right, you're up. Thank you. Yeah.
I forgot one very important thing at the beginning. If anyone needs Spanish translation, we have a Spanish translator here. Myra is going to come up and explain a little bit about how that process works. I'm sorry.
Buenas noches, mi nombre es Mayra y yo voy a ser el intérprete para ustedes esta noche. My name is Mayra, I am the Spanish English interpreter. I do not have the equipment today, but if anybody needs any interpretation, I would love to sit at your table and to translate everything that these beautiful people are saying today. Thank you so much for being here today. Thank you.
So this is it's a map of all the engagements that Commissioner did last year. Remember at the beginning of our time together, I had mentioned that this is kind of the second round of community conversations we're doing, and so we just kind of have a map of the engagement that Commission has been doing since last year. So the community conversations are the ones in the blue at the bottom, and those we went to Pueblo, Memphis, Durango, Grand Junction, Denver, Fort Collins, Sterling, and we also did a virtual meeting as well. And the ones in the red are all the other types of engagement that Commission does. Community engagement is really near and dear to Commission's heart, so we make sure that we are always out in community. And like I said, today is our crowning glory. We have been all over the state pretty much this year, and so today is our last community conversation for the season. But here are all the places that we visited. We started in June, and so we've learned so much throughout all our visits in community. So every community goal is different. The needs that you have, the support you need, the resources that are available are so different, and so it's really important for us to be with you to hear what works for you. In 2024, when we went around to do community conversations, here are some of the emerging themes that came up. So the main, kind of the main events today is that after we get through a few of these, boring slides, we really are going to have a conversation about what works for you and what you would like to see work in this region, in Southeast, in Otero, in all the surrounding communities. But and we will take a lot of notes, and some of these notes are what we put together. We put these themes together last year. So you might be able to identify some of them that may also be concerns for you here, or there may also be others that you might be doing really well or have seen some progress over the last year. And so we would really love to kind of hear more about that later on. We'll have these sheets to share once it's time for us to have a conversation. But we just wanted you to know that here are some of the things that we heard across the state last year, and we're really working on a lot of these. You will see when it comes to system navigation and school support, some of the coordination work, the themes that Dr. Russo shared really kind of lines up with some of these themes, and also the launch of the Colorado Lift and the Basils really goes to what we heard from community and what community needs. So we have a little exercise I would love to for you to do if you don't mind taking out your phones. These days QR codes are the it thing. We're all doing these QR codes. So what we really want to hear from you is, out of these top five goals and strategies, how would you rank how BHA is doing, and how would you rank how behavioral health system in Otero, in the Southeast, how would you rank how we're doing in this area? And so once you get the poll, it's a slider poll, you'll be able to move the items up and down. And so please do rank these for us to let us know how we're doing, and where there's more opportunity to improve. And so 1 would be we're doing the best in this area, and 5 would be the strategy that needs more improvement. So we would really appreciate you ranking those for us. Thank you. I see a few phones still.
Thank you.
This is you.
So as I mentioned, in July of this year, we launched Colorado Lifts. We've gone back and forth a little bit about our names, and Colorado Lifts is our name. LIFT stands for Linking Individuals and Families to Services. This is the big part of Colorado Lifts that we want everybody to know. Doesn't matter what your insurance is. Doesn't matter if you have insurance, if you're underinsured, or if you're uninsured. You can reach out to Colorado Lifts and get connected to a provider who will offer crisis, substance use, or mental health services. Doesn't matter where you are in the state, doesn't matter what your insurance status is, we want everybody to have access to behavioral health services. So, there are a couple of ways. People say, how many of y'all knew about Colorado Lifts, or even under the name BASOS? Nobody. A couple of folks? Okay, how many folks this is new information? Okay, then it was worth our drive out here. This is good. Okay. LIFTS is coordinated and funded through the Behavioral Health Administrative Service Organization, or BASOS. That might have been a name that you all may have heard when we initially launched, but as we tweaked and we wanted to make sure that everybody understood how to receive these services, Colorado Lifts is what we refer to it as. So how do you access Colorado Lifts? There are a couple of different ways. You can call, you can go online to ownpath.co, and you can search for BHA licensed providers, or you can call the number that's listed here. You'll receive a screening from a behavioral health provider. They will determine, is this an immediate need, like crisis, immediate crisis, or is it something that is not an immediate crisis 911 situation, but we still need to connect you to a provider. I see a couple folks taking a picture there, so I want to give you a second before I flip that page. But we have had a lot of planning that has gone into developing Colorado Lifts, and it's been a real pleasure to partner with 2 organizations in particular. One I will introduce in just a little bit. So these are the ways that the Colorado Lifts works. So the BHA, that's our organization, and then you've got 4 different regions, and we'll talk about those in just a minute. And those 4 regions will connect you to Colorado Lifts. And again, you can do crisis services, substance use, mental health services, and the idea is that 3 things will happen. There's fewer steps to accessing care. You don't have to go here, there, everywhere. How many of you all are familiar with the RAISE? Yeah? Yes. You can go through the RAISE. You don't have to go through the RAISE. It's a whole different system. There's fewer steps for individuals and families to get behavioral health care healthcare. It's a streamlined process. You're not going to have to call multiple places to get you connected to receiving services. And the focus is on the whole person health journey. So again, we're thinking about behavioral health safety net and care navigation with a focus on, you need behavioral health services. We will ensure that you get connected to the right folks. You don't have to You know, sometimes when you call, this happened to you today, when you call the doctor and you got to call around to a bunch of different people to get connected to the right folks, you don't have to do that for the behavioral health in Colorado anymore. You call the Colorado Lips, and we will get you connected to the correct behavioral health provider. So we're going to talk about a little bit, there are 4 different regions. We are out here, and this is region 2. I always get our regions mixed up. The individual who is the Chief Executive Officer for Signal, Signal oversees our region 2. Daniel Darden, the Chief Executive Officer, is here with us today, and he will tell you a little bit more about the Colorado Lifts and how Signal Behavioral Health Network is partnering and answer any questions that you might have. Next up, Daniel. Thank you.
Well, thank you, Dr. Rousseau. I don't know who that is, but that was maybe on July 1st when you're launching this thing. I've got more gray hair, but it's good. It's good. It's good to be here in Atlanta again. You can definitely go to the next slide. Oh, is that me? Oh no, I'm in charge. Okay.
There's a little.
Then I'm definitely going to go to the next slide. So this is the Basso regional map. We've also got some of these. We've got a few of these over here at the signal table back there if you want to keep track of it. We love our regions in Colorado, and it's less important that you know what the region is and more important that you know that Signal is here to provide connection to behavioral health care through the Basso Lifts network, as Dr. Rousseau and Judith just shared so well. Now I'm in charge of this. This is Daniel's job. Okay. Signal is an organization that has had a chance to work together with so many local providers for so many years. Before we were a Basso, we were something called a managed service organization, which also doesn't matter if you know what that is, it's totally fine if not. But that means that we've been able to fund and support behavioral health services in this part of Colorado for decades. We've gotten to work with Partnership for Progress. I know you two names ago, and now Valley-wide, of course. We get to work with Paragon, Crossroads, Rosada, and so many other good organizations who are here today and who have provided community-based behavioral health services in this part of Colorado. Our objective really in the Basso or Lift system is to provide, as shared already, direct access to care navigation support. So we have wonderful folks who would love it if you or people who you care about who are seeking access to behavioral health care, call us or email us for connection to care. Yes, absolutely right that we are providing that connection through a warm handoff. So this isn't about like, hey, here's a bulleted list of phone numbers for you to call. Good luck to you. If that is all that people want, we're happy to stay, to give them that space, but we also want to be as active and supportive as possible. We have care coordination support too, which allows for the connection to care, clinically supportive with other organizations who may be directly providing treatment or recovery services. Sometimes that might be offered by a partner treatment provider, like Valley-wide, for example, or it might be offered by Signal, depending on what is best for that individual. We also have access to lots of provider organizations throughout the rest of Colorado too. If there's a need for intensive services, for example, that might be more centralized throughout Colorado. The important thing is that we're trying to take the emphasis off the person figuring it out, which has been, for my time in behavioral health, the consistent message that I've heard as a point of frustration that it's a full-time job just to navigate somebody through care or to be in care, or for providers who are interacting to support that too. It's a hard thing. It would put a lot of burden on people who should be providing care or should be receiving care. And Signal's role is to really try to make those connections smoother and more supportive. I keep looking at this like it's going to change, and I remember I'm holding this. Important differentiation too is that we're providing our services for non-Medicaid enrolled individuals. We've got the best Ray in the state, NHP. They have been to all these community conversations in the region. None of the other Rays have done that, so I told them I would give them a shout out. But they're back there. They've also been around as a Colorado nonprofit, just like Signal, for several decades too, I think. supporting Medicaid care. They're wonderful folks. They're in community, and they are providing these same care navigation, care coordination services to Medicaid members. However, if you don't know who you should call or you're confused about what I just said, don't worry about it, because either one of our organizations are the right places to go if you need access to care. We will get you pointed and connected in the right place. We have good communication between the two of us. We don't want to put the burden on the person. We want to put the burden on us to help support the person. And that's the most important thing to take away from this discussion. I kind of already talked through this. Care management is really the one place I didn't discuss. That's really about the higher level of care coordination effectively for complex needs or family complexity that may result in a larger treatment team to provide support. Just kind of talking about what we do, it's not so much important that for those of you who might be accessing care that you understand the differences between those different levels. It's just us trying to be transparent about what we're doing. And again, the key is reach out to us, share the information about what we're trying to do. This is funded by the state. Our care navigation support is no charge to anybody who's accessing it. It's about supporting individuals with what they need. And that's the objective. And we've got a team that's eager to help. I think that's me. All right, and we're going to try to do a little bit of Q&A next year.
Thank you. So now we are at, the place, the reason why we're here, which is to hear from you all. And so what we'll do is that we'll spend a few minutes at your tables. We have 2 questions for you to consider. And for you to please, we have some sticky notes and some, I love Play-Doh, some Play-Doh for you to play with while you think through the questions. And then please share at each of your tables. You can discuss these questions, and then on the sticky notes, please write some of your feedback to those questions. But if you could please, just at your tables, about 10 minutes each, these 2 questions. And the first one is, that of the themes that BHA heard throughout the state, so those circles that I shared, Sami is gonna help us with those themes. I have a sheet of those themes, she'll bring them around, but of those themes that we heard throughout the state last year, which of them are of the highest concern in the Southeast region? If there are any that you identify as as priorities that also are of concern to you in this community, please go ahead and write on those sticky notes. But if there are others that are also, really specific to Southeast, to Ontario, to this region, please write those on the sticky notes. And then this is kind of a 2-part question. And the second part of that is, which of these areas do you see success happening? One thing that we learn is that although some of these things may cross regions, some communities are doing a little bit better in some of those areas than others. Some have seen more progress than other themes. So that's some of the things that we really would love to hear from you. That of the themes, which of them have you, in Ontario County, within the Southeast region, the Arkansas Valley, which of them have you seen success? I think what that does really is help us learn what works in the community for us to be able to also share with other communities. And then the second question is, as Daniel came up to talk about the BASOS and Taruso talked a little bit about BASOS, I am actually quite excited that a lot of you haven't already heard it, because then it means that we do have the right people in the room. And so we really do want to hear from you. We have launched the Colorado Lift. We have the lines, they are up. When the BASOS are successful, what do you want to see different in the Southeast? What do you want to see improve and be better in Ontario County over the next year, and kind of thinking ahead of the next 5 years? So we'll spend maybe 10 minutes on each of the questions, and then after you kind of go through that, we'd love for someone at your tables to volunteer to share some of what you discussed, and then we can do a few Q&A
Before we break, I do want to share with you all something that we heard in previous community conversations throughout the, particularly the Southeast region, was that folks wanted to have somebody from the Behavioral Health Administration that was familiar with rural and agricultural communities. So this is hot off the press. We've just been sitting in the back, sending out an offer letter to someone who we just got done interviewing, and they will start working for us on November the 3rd. Her job will be to go throughout the state of Colorado in rural and agricultural communities. She comes from a farming family herself from Flagler, Colorado. What did she tell me? Wheat, millet, and some kind of cow. I'm not going to quote what kind of cow she said because I'll mess it up. But her role will be to go throughout the state of Colorado and meet with folks in rural and agricultural communities. One, letting folks know what are the services that are available to them through BHA, and also hearing what are some things that we need to know that maybe we are not currently offering that will be helpful to the communities that we are trying to serve that look different than the metro regions. So I'm really excited for you all to get to know who this young lady is. She'll be coming out into your communities, meeting on farms with people, meeting wherever it is pertinent for her to meet, to hear from folks what's working, what's not working well. One of the things that we know is that in farming communities, suicide rates are some of the highest rates are in farming communities. And we really want, as a behavioral health organization, to make sure that we are coming alongside folks and offering assistance and services where people believe that they need assistance, and offering it in a way that is helpful to people, not in a way that maybe the research tells us or anecdotally people feel like is helpful, but for folks who are actually living right there in the communities that they tell us is helpful to them, we want to make sure that we're building programs around that. So, having said that, go to the questions. We're going to hop around to your tables and we will answer any questions while we're there that you all might have. But interested to hear what you all had to say about what's working well and what will success look like for the Bastos in 5 years. Thank you.
Thank you. So 10 minutes each. This question one of the themes we had, which ones are of the highest concern, and then what is working in the Arkansas Valley, in Otero, and the Southeast, really. So I want to start with this table.
I work with the schools. I'm the librarian at the La Junta High School. And so, of course, that's my realm is kids. So school outreach is really important to me. And because I wasn't aware of these programs and they are so beneficial for what our kids need, I think that's one of the things I'd like to see, outreach in the schools, just having them aware. Maybe some infographics that we can post through the school, talking to school principals and school counselors, including them in the conversations that we have, because they're on the front lines there with those kids that are struggling. I think we have a lot of kids that maybe don't have direction, and it's not maybe a crisis situation where we say, oh, we'll dial 988, but it is something that's an ongoing need for practical guidance. Maybe they have a multi-generational thing going on where they don't know because mom doesn't really know and her mom didn't really know. So giving that kind of counsel to them from somebody who's authorized to do that, because that's not my lane and I can't overstep that. So I think we have some great programs. I think working is the program for I Matter. I do have a lot of that posted through the school, and I've had students tell me they have called that and taken advantage of that program.
Thank you. So services for youth.
Right, services for youth.
And if I could highlight success,
Yes.
right, because I think it's very important that we look at our successes. It encourages us and it can embolden us to continue on and to do more things. It's kind of under housing, but it's temporary housing. The last 3 years, our community has set up emergency warming shelters for those experiencing housing instability and security, for stranded travelers during blizzards. And this dude right here, raise your hand, Val, just do it. Thank you.
He's a volunteer that comes to those shelters and he cooks. You cooked the ribs last year, huh?
Yeah, we had ribs.
If you want some good ribs, come to our warming shelters and he makes a mean rib. But we invite people in. We have a local church that hosts the warming center, and it's spearheaded by a number of different organizations. One of them is a grassroots organization called Yeehaw. Yielding, what is it, Chris? Yielding effective entry into housing and well-being. What do you know? Yeah. Yeehaw. And Val's a great example of volunteers coming and helping people. One of our big successes is one night at one of our shelters last year, I think it was in November, we got a call from the local ER. An individual was abandoned at the ER. She was a double amputee, wheelchair bound, and they dropped her off and they took off. So we had a couple volunteers go pick her up about 1:30 in the morning, and working with local organizations, we got her a plane ticket back to her brother in Arizona. That's a local success, born and bred in Southeast Colorado.
What would you like to see when the buses are successful?
Say that.
For question 2, what would you like to see happen? What difference do you want to see if the buses are successful in the Southeast?
I'm big into primary prevention.
Primary prevention.
I work local public health with 3 counties, and ounce of prevention is worth a pound of cure. And if we could do upstream prevention, get these kids the help they need early on, help them with both SUD issues, prevention, and behavioral health issues, we're gonna have healthier, happier adults. We're gonna see public health outcomes improve, and not insignificant, we're gonna save a lot of money.
Thank you. You like it? Yes, please.
All of us, or just me?
Go ahead. Go ahead.
I don't know, my notes are gone now.
Are they?
Somebody collected my notes, but honestly, I'd like to see more on this. They started the Osborne project with the low-income, no-income housing, and I really am eager to see how that is going to work. And if so, then we could do this multiple times.
Thank you. That's
all I have.
When you talked a little bit about peer services, removing barriers for you to be able to do your work more effectively.
Yes, you have my notes.
Thank you.
Sorry.
Thanks for sharing. Next table, please.
She took my notes too, so. So for what we're seeing, like what's not working so great or we're needing some help on in this area, a lot is transportation. Especially because we have like a lot of rural communities, but like the main hub is usually Lahana, that's where everything's at. So getting people from all their surrounding areas over here, and then our regular transportation, like the hours aren't super great either. They close well before our offices close. And another one was the workforce and housing. We are seeing some like new things in housing, but housing still is a struggle. The Osborne project is coming up, but it's 30 units. That's great, but we have a lot more than 30 people who are, struggling with that situation. Some of the things that are working was our system navigation, and then the amount of SUD and behavioral health services that we do have in the rural community. I feel like there was another one, but I don't remember what it was. Maybe not. And then the last question was just that we would see like seamless care.
Thank you. This table?
Okay, well, I feel like we're all valley-wide, so we are facing a lot of the same issues, so we definitely talked about that. I think system navigation, we are finding a lot of ways to help, but that's still going to be a concern. It's still kind of a complicated system. Definitely transportation. We also talked a lot about telehealth is a fantastic option, but we have a lot of areas in our region that they struggle with connectivity. We don't have good service there, so that's definitely a concern. And then of course transportation is always a barrier for us, especially if we're trying to get people into specialty care and facilities. So.
Thank you. What would you like to see improve when the buses are successful?
I don't think we actually got to that question, but some of the things people have brought up bring some things to mind, including awareness of all the services that we do have in these areas. I think there's at least 4 providers that have been here tonight, and that's a lot of providers for our rural areas. And there's more, not everybody's here. And so making sure the schools and the other community partners are aware of all the services and how to enter those services.
Thank you.
All right. So I just want to point out there are 3 different organizations at my table. Of the 10, we picked 2 each and come up with 6. So we were in agreement on nothing. I will discuss the 2 that I think are the 2 biggest challenges based on what's listed on the page, and then I'll let Mickey and Renee go over what their thoughts are. But SUD and behavioral services in rural communities, I feel is a big one, just because in a small community, when you're dealing with individuals that may have not been the best fit for 1 or 2 organizations that no longer will accept that client, you quickly run out of options. And so, small community or not, it's just kind of defeating when you've got that individual that's struck out at 1 or 2 places and they're quickly burning out of options. So that's something that we do face from time to time. Access to community behavioral health services or resources, again, small rural community, that's always going to be a challenge. Renee?
I work in detox, so what we see a lot is the housing. A lot of regulars come in and use it more as shelter rather than they will use just for the shelter, especially when the weather starts turning and stuff like that. So again, housing is a big issue, and also transportation is big for them also.
All right, so I went with the school support and the prevention services for all ages. I think around here we tend to see more of the help being offered once it's an issue as compared to trying to be preventative for it. And the school support, I think that is going to vary from the demographic, but like from where I'm at and what I see, that's one of the biggest places where you could be at. That's also going to help out with that prevention. So that's what I came up with.
Thank you. And when the buses are successful, what do you want to see?
I'm excited about the lifts aspect of that. I think streamlining it, making it easier for individuals is going to be huge. And I would like to see as a result of that, maybe that encourage other people to get signed up, get better numbers through the ease of that. So that's what I would like to see.
Awesome, thank you. I was at this table too briefly, and you did share also about recovery-friendly workforce.
That's always a challenge. The recovery-friendly workforce in a community this size, you deal with stigma, that kind of thing. That's never far from our minds and our hearts. It's just workforce is such a difficult topic in general, but we really want to ensure to be good advocates for those that are in recovery, that have something to offer. Otero County Health Department is a recovery-friendly workplace. We've had incredible success with that, so something we always want to really push for.
Thank you. I know there are a few tables with like a couple individuals. Anybody else want to share? Then Dr. Russo will wrap us up. Anything else that hasn't been mentioned? I can look at a few of these sticky notes to see if there's any other thing that came up. Infographics for school use, so just making sure that, a lot of the resources are available for schools and that schools can use them. Enrolling in care, just getting the numbers for enrollment high up for the Colorado Lift. Support for underage kids, independent from parents, to develop coping mechanisms. So the same preventive services and providing that care so that kids can be resilient and be able to cope outside of their parents. These are great. A few more here. Housing is coming up a lot. Jail-based services. We talked a little bit about jail-based services. Ensuring that there is that smooth continuum of care, throughout the system. We also talked a little bit on this table about supporting individuals throughout the journey, and not just, at stages of the journey, but supporting them throughout. Housing is, there's a lot of housing, transportation, housing, workforce. So those are all kind of the common themes that came up.
That's good. I'm interested in knowing, I heard two sides of the workforce coin. One was recovery-friendly employers. That's really helpful. And then in the back, I heard workforce from a standpoint of if folks are needed to have master's level training to do the assessment, you have one of two issues. Either folks don't necessarily have the resources to go to school, or they go to school and then when they finish, they go to larger communities or other communities. Are there any other workforce issues, either that I've described or something else that would be helpful for us to have on our radar? We're really reframing and reorganizing our workforce development in behavioral health, in the Behavioral Health Administration, so that's why I'm in particular asking that. We'd like to see if we can really identify what the root issues are so that we can really begin to address them.
One big issue is assessing a person's readiness to enter the workforce.
Okay.
If they haven't been in it a while, they maybe suffered from SUD, substance use, experienced homelessness, been out of it a while, and their long-range goal, their horizon is just always 24-12 hours surviving the next.
Okay.
And so in our public health practice, what we've experienced, and I think Chris will agree, is we've put people in the workplace and they don't have basic computer skills. They weren't ready. Okay. They couldn't create a folder on the desktop.
Gotcha.
And so basic skills like that are going to make them entry level. Yeah. And if we don't do that, then we're going to get a reputation with employers. Well, health department sends us these people who aren't ready. They don't have the skills and they crash and burn. So we've got to assess them, and then if they're not ready, we've got to get them ready. Okay. And Mr. Mangus, applaud him. He was right there helping with those basic computer skills to make sure that this person who was inserted into the workforce had a successful experience.
That's helpful. So also workforce from the standpoint of people don't necessarily want to be peer specialists. They want to return to work. They're clean, but they need to achieve basic skills that would have been lacking during the time when they were using it. That makes sense. Okay. Any other ones? Yeah.
So it's hard to find people who are going to apply to be a peer specialist.
Okay.
And then finding people who have had enough recovery time, and then also getting them trained and credentialed takes about a year to actually get somebody hired, trained, credentialed, and going.
Yeah. Are you all having problems getting? I hear the length of time, but is there any challenge with getting them the correct coursework to be eligible, or that's not a problem? You can get that.
Yeah, that's not the problem.
That's helpful. Okay, that's good for us to know.
It's getting the applicants.
Okay, okay.
Minimum qualification.
I got you. Okay, that's helpful.
And strong enough in their recovery.
Yes,
Yeah,
strong enough.
strong enough in their recovery to be able to come along somebody else. Understood. Okay, that's helpful. Okay, I love it. I think it was you mentioned the housing, the 30 units. Can you tell me the name of that again? Osborne. Perfect. Okay, I got it. All right. These are all really helpful to us. Our goal, our hope is that as we hear from you all, not just here in this community conversation, but even as we send other behavioral health employees into community to provide feedback about what is working and what isn't working, when we come back and see you in 365 days, give or take, you all can say to us, we've seen this improvement, or we've seen this and it didn't quite get us where we thought we needed to, but these are some thoughts that we have. And so, as I mentioned, even being, there was somebody that specifically spoke to Commissioner Smith about coming to La Junta. Are you in here? It was a woman. No? Okay, all right. That's all right. That's totally great. That means that the word got around and there were others that were interested in coming out to hear, but even more importantly, to give us feedback. And we really, really appreciate this. You all will have our, how do folks get in contact with us?
So many different ways.
Yes.
I actually wanted to share.
There we
So
go.
this one is a feedback form for this whole conversation, and so we really just want to hear how these are working for community. You know, is this something that is valuable to you all, and you know, what can we do better? But there are so many different ways to engage with us, and so we have the regional council. So the BASOs we have created regional councils for the BASO region. So each region has a regional council, and you know, on these regional councils are various representatives, people with lived experience, people who work in the school system, people who are providers, to make sure that we can share your experiences with the BASOs. I feel like Chrissy could do a better job of the regional council. Chrissy Jordan is, she's in charge of the BASO regional councils in this region. And so a great way to engage with us is to be engaged at the regional council meeting. So those are our public meetings. We will on our, I don't have access to our website, but on our BHA website, when you go to our events calendar, we'll start putting some of those meetings on that. Those are ways to continue engaging with BHA. We have so many various councils. We have the Behavioral Health Planning Advisory Councils. We have the Behavioral Health BHAC. We have various councils that you can engage with us, but also, as Dr. Russo mentioned, we will have a local, someone who will be doing rural work, and I will share my card around, and you know, of course, Chrissy and Daniel are here from Signal to really engage with all of you. So there are so many different ways to stay engaged, and we really do need you to stay engaged with us. It's the only way we will know what you need and what's going on in community, and if there's any difference at all that all of this is making, and what tweaks we can make. So we definitely really appreciate you staying engaged, and thank you for spending your evening with us. Dr. Russo,
This is probably the wildest thing you've ever heard. I'm going to give you my boss's phone number.
She loves to have your phone number.
Yeah, she will probably be delighted that we gave it out. So I will call it out to you all. 704-726-7265. 704-726-7265. So as there are emergent needs in community, or there are things that we would that's good to have on our radar, feedback that we need to know, we welcome you all to reach out to us by the survey or by contacting our commissioner. 704-726-7265. We look forward to hearing from you and seeing you again next year to receive feedback from you. Thank you all. We appreciate you.
Thank you.
For Ryan Medical and the people of Southeast Colorado, with your Southeast Colorado News.